naked eyes. So then gloves, mask, protective eyewear and gown must be used when drawing blood from a patient. Now, have you been anytime, did you have a visit in hospitals? You have been? Which ward did you go? In hospital visit? Oh, not from here? Like otherwise you had a visit. Which ward did you go? Every ward. You went to medicine ward? Did you see blood drawing? Drawing blood. The sisters are taking blood from the patient. Yeah, so did you see her wearing gloves? Yes. Why do you think she wore the glove? To avoid spread of infection, to save herself from see again, to wearing glove, mask, protective eyewear and gown must be used for when drawing blood from a patient. This is so that for your protection, because the patient when you're drawing blood could be positive for anything, for any serology, HIV, HCV could be positive. To save yourself so that you don't come in contact with the blood, if there is anything, 1 or 2 drops come out while taking it and you have a micro cut in your hand, okay, which you will not see, you will not understand, it can enter inside your body through that. So to avoid that, we wear gloves and protective eyewear and gown. Now you know why doctors wear gown or people in the labs wear gown. This is not to show that we are doctors. Actually, this acts as a barrier. Wearing long sleeve gowns, it protects you from outside any infection or anything. It acts as a barrier. So wearing gloves, mask is very important. Mask we started, it's been widely used after COVID-19. Then this vinyl removal and handling of all patient specimen, disposal, non-sterile latex or vinyl gloves provide adequate protection. Again, also while handling any specimen, as I have said earlier, gloves are very protective and it's very important before that, before taking any blood or handling with any patient specimen. Facial barrier protection should be used if there is a significant potential for spattering of the blood or body fluid. Now, you know what is spattering? You know what is the meaning of spattering? You know what is spilling? Yeah, it spilled. Suppose this water, it fell from the glass on the floor, it spilled. But what is spattering? So suppose the water, it fell from the glass, okay, it fell down, it will fall down, but few will spread also on the wall. Suppose it fell here, it will spatter on the wall as well. Okay, suppose null say when some water falls from the tap, it spatters on the wall also behind, right? So that is spattering. So facial barrier protection should be used if there is a significant potential for the spattering of the blood or body fluid, because it's very easy to enter your body. Otherwise you won't see, it might be on your clothes, that's why we wear the gown, it might be on your clothes, your feet, that's why we advise to always wear shoes when going into hospital setups, into wards, clinical setups. It's always advised to wear shoes. Now why? This is for your personal protection. And also doctors are also exposed to many patients. You are a single doctor which will be exposed to maybe a positive tuberculosis patient as well and a not positive normal patient as well. So you can act as a carrier as well. So you being cautious will save another person's life. So that's why using facial barriers and proper gloves and gowns it's very important. So wear protective clothing which serves as an effective barrier against potentially infective materials. When leaving the laboratory, protective clothing should be removed. Again, the same thing as I said, wearing the barrier things. And why should it be removed? Because if you had an exposure, if you remove it, it will not spread outside the lab. Am I going too fast or is it fine? It's fine? Okay. So use of disposable syringes and needles. When I was young, what happened was, when I was vaccinated in my time back when I was an infant, they used glass syringe. Did you see glass, made of glass, syringe made of glass or metal syringes? So what used to happen is, suppose the syringe that was used for vaccinating me, they would boil it and at home, they would boil it, or somewhere in the hospital, they would boil it and the same syringe would be used for someone else. That was the practice, which is not good. So now this is not used anymore. This practice is stopped now. So we use disposable syringes and needles. Dispose all sharp objects appropriately. Now, why is this important? Why disposing all sharp objects appropriately is important? What will happen if we don't? If we just throw glass or a needle somewhere, what will happen? Yeah, somewhat. It's very basic. What will happen? If I throw a piece of glass there, what will happen? While walking, somebody can get a cut. Somebody can get a cut, or animals can get harmed by it, environment can get harmed by it. So disposing all sharp objects appropriately is very important. Avoid reusing syringes and dispose of needles in rigid containers without touching this using one-handed technique. Now when you're discarding a syringe, you should know how to do it. First of all, you'll not reuse a syringe. Syringe, when you use for a patient, it's always inside a packet. You'll open the packet, use it for one patient, and after that, you will discard it. Now, you have used it, but how will you discard it? Anyone knows? Do you know how to discard it? No. Suppose this is a syringe, okay? So you have used it, you have taken the blood from the patient, and now everything is fine. Now there's a plastic part, right? And the needle part which you get pricked with. The needle part goes into a white transparent container. After burning the needle, it goes into a white transparent container, and the plastic bodies goes to a separate container. And that is very important, because the white container where all the needles are being stored, that goes for burial. It can't be discarded with the plastic body. Not the full thing goes into the separate one. Okay, the needle is discarded separately. Do not touch your face when with your gloved hands. Make a habit of keeping your hands away from your mouth, nose, eye, or any other mucous membrane. This will reduce the possibility of infection. Now, after wearing gloves are sterile. Before any procedure, surgeons or us, everybody, we wear gloves to protect ourselves. They are very sterile. So, how do you wear a glove? What do you do before wearing a glove? Hand wash. Do you know how to do hand wash? Anybody taught? Yeah, how to do hand wash? He nodded. How to do hand wash? Huh? It was taught, so you should know. Show me what are the steps. Yeah, no, tell it. Yeah, some, Six steps. Yeah, so this is very basic but very important. Not now, I'm just telling you. So before wearing gloves, you should always wash your hands. Very basic, hand to hand, back of the hand, crease of the fingers, crease of the palm. Can you see? Crease of the palm, thumb, okay, then tip of the fingers. This is very basic, not included here, but I'm just showing you. So this is of 2 minutes. Hand wash is for 2 minutes, and it's very important. So you cannot just enter into a surgery without washing your hands, just wearing your gloves. Nobody will see me. No, it's not like that. So this is very important. Each step is for 20 seconds whatsoever. So before and after wearing gloves, you should always wash hands. Whenever gloves are changed as well, you should wash your hands, and this is very important. And after washing your hands, how do you keep it heat on? Like this. You don't touch anything. You keep it like this, and you close the tap with your elbow. Okay? So do not leave open flames unattended. Now what will happen if you leave open flames unattended? Could catch fire. Do we leave the gas stove on when we are not cooking in our homes? We don't. Smoking, drinking, eating in the laboratory should be strictly prohibited. Minimize spills and spatters. Now, lab is not a place to smoke, drink, eat or party, is it? No, it's not. So you can say that, okay, I'm wearing a glove, I'm performing an experiment, I can use a spoon and have my food. No, that should not be used. If you don't know when the spoon got contaminated and you're taking the food in and you're swallowing it nicely. Okay, so it should not be practiced. Work area and reusable devices should be regularly disinfected. Decontaminate all surfaces and reusable devices after use with appropriate registered hospital disinfectants. Now that is very important. After you finish your experiment, you have to clean it. You have to clean it and keep so that it doesn't spread. If there was any spill or anything, it doesn't spread. You have to clean it neat and clean. All sharp objects and infectious materials should be properly disposed of. This line is very important, and I'll discuss about it in detail, like where to discard what. Where to discard what, I'll explain it. Now, did you ever come across this signs in your life ever before? These are some symbols which you should know. Now, who can tell me what is toxicity? Toxicity, anyone? What is toxicity? Yeah. Then what is acute toxicity? What is the meaning of acute? Acute, have you heard acute, chronic? Yeah, somewhat right, sudden. Acute, chronic. Okay. So acute is short. Yes, exactly, it's right. So acute toxicity is sometimes in hospitals, when you'll be clinically exposed, you will see a patient is admitted who ingested poison. Okay, somebody in Tripura, you know, before coming to Tripura, those who are from outside, did you research about Tripura? What is Tripura famous for? No? Anyone? No, it's for rubber production. So rubber acid poisoning. Okay, done. So rubber acid poisoning is very common. Okay, here in Tripura, rubber acid poisoning, you will get it. Rubber acid poisoning, organophosphorus poisoning, OP poisoning. These are very common, some of the cases that you will see. So these are acute toxicity. You can say that these are acute. So what happens is, OP is common because this is a pesticide used by farmers. So it's very easily accessible. OP poisoning in short. So those are acute toxicity. Now chronic would be something which is entering your body daily, slowly, little by little, for a prolonged period of time you are taking it. Okay, slowly, in small amounts you are taking it. So in Japan, okay, there was a, did you heard about Minamata? Yes, what happened in that? Huh? Mercury, yeah, mercury, yes, mercury. So what they were doing is, from the factories, they were discarding the mercury into the water bodies. Okay, so from there the fish were eating it and the people were eating the fish. So they were taking the mercury indirectly. So that was the Minamata. As well in West Bengal, arsenic, did you hear? The Blackfoot, yes, the Blackfoot, the black teeth, did you hear of it? In the rural areas. So that was also, the source was the water. So that's why in our class 12 EVS, I think you have read that don't discard the factory into the water bodies and all that. So yeah. Again, what are the hazards to the environment? Tell me, hazards to the environment. What could be hazards to the environment? Some examples. Hazards to the environment. This is very easy. Come on. Some hazards to any sort of pollution, noise pollution, air pollution, anything, soil pollution. Yeah, health hazard and hazardous to the ozone layer. Now, what causes hazard to the ozone layer? CFC. How does this one? So CFC, what it is doing, it's causing hazard to the ozone layer, and that is why, how is it becoming health hazard? Because of the depletion of the ozone layer, the UV rays are coming, and that is why the skin cancer cases are increasing now. So somebody told me yesterday, so everybody back to the topic. So as I was saying, the ozone layer, yesterday somebody said that, ma'am, the ozone layers are healing. It showed me in Google. So the thing is, when you come below the line, the ozone layers are healing. It says that it is supposed to be healing by 2066. So by that time, we all will grow old. So it's a prediction, it's an aim to heal the ozone layer by 2066. Okay, just like glaucoma. It's a disease of the eye. It's a silent killer. It blinds you, okay. So it was it will be in your ophthalmology in third year. I'm just giving an example. It was supposed to be eradicated by 2020, but it's 2024 now and it's still there. So tell me one example of a disease that has been completely eradicated from the world. Yes, smallpox. So some things are there, you can follow Google, but it's better to give reference. Following Google and arguing is not good. So what is serious health hazard? What is serious health hazard and what is not so serious? If there is serious, there could be something that is not so serious inside your biochemistry lab. Suppose you get a cut with a broken glass. Is it serious? Just a small cut. Is it serious? It's not. Something, if somebody has swallowed some reagent, now that is serious. That is serious and that could cause some harm to your body. So what is gas under pressure? We see it in our day-to-day life, gas under pressure. Exactly. LPG cylinders, oxygen cylinder used in hospitals, those are gas under pressure. Now, in my second slide, I showed some 4 hazards. Do you remember what were those? 4. I told I'll explain in detail as I proceed. What were those? Fire. Yeah. So chemical hazards. These apply to all who use chemicals in their work. It is wise to regard all chemicals as toxic unless you know otherwise. Now, chemicals are not something like you play with, it's looking beautiful, so you'll smell it, you'll touch it. No, that is not something you do with it. So, the main dangers to the person are associated with toxicity, chemical burns, and dermatitis. Now, it's very easy while you're handling it, getting a burn, getting a drop in your hand or somewhere in your body, it's very easy. And to get a burn or dermatitis, when it comes in contact with your skin, it's very easy. Now, chemical related risk of explosion and fire are also possible. Yes, very possible. You are using flames, so it's very possible. Toxic symptoms may follow ingestion, inhalation, and skin absorption. Again, as I have said, ingesting, you won't see how you have ingested or inhalated, which can go into your stomach or it can enter to your body through your eyes. It can go to any system, any system in your body, your lungs, anywhere. Swallowing strong acid or alkali causes corrosive poisoning. Now, if you are seeing there is an acid and out of curiosity to taste it, if you are swallowing it, that is not advised and that is really foolish if you are doing that. So, these all things should be avoided. Now, physical hazards. Hazards of glass are the biggest cause of lab accidents, yes, because we are dealing with glass. We are dealing with everything, mostly everything is glass. The pipette, the test tubes, the beakers, everything is glass. So, getting an injury with that is more common. So, more than 30% of all laboratory casualties are cuts and from broken glass. If one is not careful enough, profuse bleeding might result following a deep cut. So, if you get a cut, so femoral artery. In anatomy dissection, have you heard of the term femoral artery? Yes. So, if you get a cut in there or any artery, any deep artery, you can bleed and you can die. It's that severe. So, it should be treated and you should pay attention to the bleeding immediately, not to play with or ignore. The glass may also be contaminated with stool, pus and bacteriological cultures, resulting in severe infection. Yes, suppose the broken glass that had a specimen of stool. Okay, now you have cut your finger with it as well, ma'am. So if you get a cut with it and there was the stool specimen was there, will it be good for you? It will enter to your body through it, so that won't be a good thing. So that you should look after. That that the glass contaminated with stool, pus and bacteriological cultures resulting in severe infection. It can be very severe. Accidents occur in the lab mainly through ignorance and lack of foresight and lack of care. Yeah, we are sometimes careless and nowadays people work seeing their phones. So that turns out to be, one of the cause for the accidents inside the lab, lack of carelessness. A careless worker endangers not only himself, herself, but also his or her colleagues as well. Now, if you have spilled something in the lab, not just you, your fellow mates will also get a little bit of share of that, right? Not just you. The people in front, the people behind you, the sides, they'll also get. So, not just you, you are endangering the life of your friends as well. Now, electrical hazards. It can be caused by faulty electric circuits. Again, as I have said, the loose circuit. If there is some loose circuit, some open wires, it can catch fire or it can cause harm, give you electric shock. Incorrect installation of equipments. Touching exposed live wires. Now, out of curiosity, somebody is going and touching to see if they get electrocuted or not. That's not good. Use of extensive cords is prohibited. The extensive cords, why is it prohibited? Suppose you are walking and you did not see down, so you could slip, you could tip and fall down, you could slip and fall down. Now, OSHA regulations stipulate that the requirements for grounding of electrical equipment of the National Electric Code published by NFPA to be met. All electrical equipments must be turned off after the use. We all say while we leave the room, at home also we do it. After we finish work in one room, we're going into the next room. We switch off our fans, lights, ACs. Now, fire hazards. A significant fire risk exists in laboratories due to frequent use of matches and open flames in close proximity to highly flammable chemicals and reagents such as acetone, diethyl ether, methanol, acid alcohol, and stains that are alcohol based. Now, tell me something that is very flammable but we use in our day-to-day life. If we use it, most of you have used it today also. Perfume, yes. And sanitizer. Yeah. So, the risk in using fire in labs is is in close proximity. So, all the chemicals are there. The easily flammable chemicals are there. So, when you light a match, so it could catch fire very easily. So that is a very possibility of something, getting into something very dangerous from there. So fire may also be caused by overheating in faulty, poorly maintained electrical equipment, overloaded of the electrical circuits, overheating of electrical motors due to inadequate ventilation. Now that's why ventilation is very important. Fire blankets for smothering fire on clothing should be available and easily accessible. Now, we all watched Bollywood movies. We all did. So, we saw it, right? When somebody is on fire, they run with a blanket to cover that person, right? Just so that the fire, that oxygen is, the supply of the oxygen is not there, and so that the fire is can be, dimmed. That's why. And also they say that while using LPG gas cylinders, they always say if it catches fire, to put a wet cloth on it. This is the same thing. So the location of the fire safety equipment and location of the fire alarms and maps of evacuation routes are dictated by local fire marshals. Now, suppose you know everything. Everybody now know what to do, what could be the hazards, but there is a spill, accidents can occur, there is a spill, somebody got acid on their hand. Now what to do? Now acid splash on skin, wash with tap water and then with 5% solution of sodium carbonate. Alkali splash on skin, wash with tap water and then with 5% active acid. Phenol burn, wash with plenty of tap water and then polyethylene glycol with water. Now, splash in the eye. This is also very important. If you are having splash in the eye, if you think, even if you are in doubt that while performing any experiment, you had a splash in the eye, you should definitely go to an eye specialist. You should get a check. Accidental swallowing, spit out immediately. Yes, please, if you think that it went inside your mouth, don't swallow it. Spit it out. Wash with dilute antiseptic mouthwash and rinse thoroughly. Injuries caused by broken glass. Wash wound immediately with a disinfectant. Minor burn. Bathe the area with cold water and cover with sterile dressing. In all cases, after first aid, seek medical aid at the earliest. As I have said, You will get first aid, but you should go and you should be confirmed that it is not causing any harm in any way if you have come in contact. Now these are the ready to use first aid kit that should be there in the lab. Not that somebody got acid or alkali in the hand or somewhere on the face and then we are running and searching for it. Like, where is it? Where is the base? Okay, it's not like that. So 5% aqueous sodium carbonate, 2% sodium bicarbonate, saturated boric acid, betadine, 5% acetic acid, glycerin, Dettol, Savlon, antiseptic mouthwash, sterile gauze or cotton. You know what is gauze? Have you seen gauze? You have seen. You know patti in local term, we say patti, malam patti. So that white cloth that comes, that is the gauze in medical term. So band-aids, adhesive tapes, scissors. So these are for the bandaging and all with Dettol and Savlon. These are antiseptics. We wash it to clear the wound if there is any cut, and then we put some if there is something that went inside the mouth, we use a antiseptic mouthwash. So that is it. Now this is very important, as I have said, hospital waste management. Where to discard what? Have you seen this colorful dustbins anywhere? Have you come across? Yeah. Do you know where to discard what? No. So this is very important, not just for your theoretical or practical or just for till you are studying. In your medical life, when you go into hospital, when you are working, when you are practicing, it's very important that in which color dustbin you are discarding what, because waste management in our field is very taken very seriously. So hospital waste management is divided into two groups: general waste and biomedical waste. In general waste, you will see a black, you can see the black container. So in that, this comprises of 85% of the total waste, which will be segregated in black containers. Like our day-to-day uses, okay, these dustbins are not the dustbins we use in our home. This has no relation with that. So in our day-to-day life uses, whatever, suppose we have to discard anything, a paper or fruit, anything we have to discard in our day-to-day life regular use, we'll discard it in the black container. That is in the general waste. In biomedical waste, that is the yellow container, goes human anatomical waste. Now what could be human anatomical waste or an animal anatomical waste? What could be? Tell me human. Yeah, but that's not anatomical. Stool, urine is not anatomy. Anatomy is what? Body. Huh? Yeah, exactly. Your body parts. So, you know, you heard maybe in your family somebody had gallstone operation. So where did it go? Where did the gallbladder go? Is it some diseased part of your body? The surgeon is operating it, taking it out from your body. But where is it being discarded? Where is it going? What happens to it after that? Okay, suppose after cesarean, after the baby has been taken out, where is the placenta going? You know what is placenta? Where the baby grows. Yes. So where is it being discarded? You can't just throw it somewhere. The animals will come and attack to it, right? You just can't discard it. So all these things, even the minute of the thing, okay, the minute of the thing, maybe some necrosed part of your body, something. Necrosed means, you know what is necrosed? That पच गया जो बोलते हैं ना in Hindi, पच गया, that is necrosed, okay. So that part that got amputated, okay. So where is it going? It has to be discarded in the yellow container. So soil with infective specimen, example gloves with blood. So if there is any glove with blood, okay, suppose some gloves you have used, so where will you discard it? Expired or discarded medicines. Now there are lots of medicines in hospital. Some might get expired as well. So where will you discard it? In there, in yellow. Blood bag, vaccine and culture, all these waste. Blood bag. Have you seen blood bag? Anyone? Blood bag. So after the blood is being transfused to the patient, what happens to the bag? It will be discarded in the yellow container. And then vaccine and culture. vaccine vials or expired vaccines, all these things, not the vial actually, those are of glass, the vaccine itself, the inside the vaccine, the dose that you get, the expired ones, and the culture, all this goes to the yellow container. And what happens to that? All these waste should be burned. All these are burned. Okay. So in the red container, IV tubes, bottles, serum container, urine bags, syringes without needle, gloves, and vacuumators. So IV tubes, do you know what is the IV tube? Anyone IV tube? Did you see somebody taking saline, patient taking saline? That wire is there. Wire. Please don't talk. If you have something to ask me. I am noticing, don't talk. Yeah, you talk to me. Please don't talk. I have told you, don't disturb. 3 of you. If you have to ask, please ask me. You discuss after the class because this is distracting, okay? So don't do that. So you have seen the tubes. People get saline, that tube. Those are IV tubes, okay? So those and bottles, like the saline bottles, the saline this, you have seen those hanging in the wards. Those, then serum container, urine bag. Somebody told me they saw urine bag in hospitals, urine bags, syringes without needles, gloves, and vacuumators. Do you know what is vacuumators? Did somebody give blood recently? Yeah. Was it in a suction method or they pulled with the syringe? Suction, that is the vacuumator. Okay, now this is a little advanced way. They'll just put the needle and that will be, because of the negative pressure, it gets pulled by itself. So you don't have to put the old way. All these waste products should be recycled. Now all these goes to recycling. Now tell me what will happen. Suppose a clinical scenario, patient had a OT, okay, and after OT, before discharging, the dressing was done. So the old dressing, we should go to yellow when to red, okay. What will happen then? The old dressing, the used up dressing stained with blood or pus or anything, body serum, that went to the red instead of yellow, then what will happen? Exactly, you are very right. Now what will happen is, since red, the things that goes in red, they are recycled. That is why it's important. Where you are discarding, that's where it applies clinically. If you're not discarding the used up plasters in the yellow and instead of that you're discarding it in red, what happens? It contaminates, because it's already contaminated. So it contaminates the rest of the things that are recycled in red. So that's why color, knowing the color and where goes what, it's very important. Now in blue, we give metallic body implants and all types of glassware. All these waste should undergo deep burial. Now metallic body implants should be, if somebody is having any ortho OT, there they use the metallic things. So that is a different topic. Anyway, the metallic body implants they use, and when they take it out, that goes in blue. And any other glassware, as I said, if there is a broken glass in your lab, you collect it, but where will you discard it? That goes in blue, and all this should undergo deep burial. Now white transparent, okay, this white box is not the one. The white transparent box where the needles go, that is transparent, and that is of like glass or a plastic, but a transparent one. Now can you tell me why it is transparent? The white box, why is it transparent? Yeah? Yeah, exactly, because so that we can see that this contains sharp objects. Now sharp objects in hospital could be needles, scissors, blades, all these things. The scalpel that you are using in anatomy, like that. Yeah, it could be. But it's a component of blood. It could be or it could not be. You don't know if the blood sample itself was infected or not with anything. Before any operation, it's not part of the topic, but still I am saying, before any operation, we as doctors, before any report, we will always go for the serology, if the patient is having the serology report or not. So serology is like HIV test, hepatitis C and hepatitis B test. So if the patient is positive for any of this, so does it mean you'll not do the operation? Can you say that no, मैं तो नहीं पकड़ूंगा, मैं तो नहीं करूंगा? You can't ignore. So that time you have to take another extra precaution. That is a different topic though. That is another extra precaution. You'll have class in that. Okay, that is extra precaution. And after the OT, you have to discard everything very carefully, and you have to disinfect the whole OT setup. Anywhere that patient has gone, they slept, even the bed where they were after they were kept after OT, everything should be disinfected. It is that severe. Okay. So, any questions you have? Tell me from here. But it came contact to you. Then? Huh? No, it will go in the same thing because it doesn't. Yeah, that's a good question. Even if it is positive or not, it doesn't really matter. We treat everything. Once it is a waste, it is a waste, and it is very serious. It's not something to wait. Once it is a waste, it's a waste. Be it positive or be it not, if it is a waste, it has to be properly discarded and it has to be buried. The things that has to go and recycle will be recycled, that has to go to bury, it will be buried. So it doesn't really, we don't really go checking was it positive or was it not positive. So that is not the, if it is out, then it's out. And it is our responsibility, because I tell you, if you don't discard it accordingly, then people who are working in the ward, they'll catch you. And it is that severe, I'm telling you, in your clinical practice.